Good morning, everyone. Myself, Dr. Anusha, Assistant Professor in the Department of Community Medicine. And today we are going to discuss about hidden hunger, which is micronutrient deficiency. And now we will see what is hidden hunger. Hidden hunger is a form of undernutrition. So you can remember, like, hunger means we need food, but we are not getting food. So like that, you can remember it is a form of undernutrition, and that occurs when intake and absorption of essential vitamins and minerals like zinc, iodine, iron, fluorine, calcium, magnesium are too low to sustain good health and development. So this is not like calorie deficiency. So calorie deficiency, we will see protein energy malnutritions. So in that the kwashiorkor marasmus, by seeing one person, by seeing a child, we can tell that he is too lean. He is suffering from one of the undernutrition problems. Like that, we can tell by seeing the person in calorie deficiency. But in hidden hunger or in micronutrient deficiency, by seeing by external appearance, we cannot tell that this person is suffering from micronutrient deficiency, and this person will look well fed, and so it is very difficult to detect without clinical testing will happen. So this happens in two different scenarios. When the intake is less, that is nothing but poor diet. So limited dietary diversity, and we are relying in staple foods, and which is lacking essential micronutrients. Or in another scenario, like increased needs. Increased needs are also two kinds. Increase in needs like during pregnancy, lactation, and the child which is who is growing, and during growth spurts. So this micronutrient demands will be high compared to the normal person. Or when the person is suffering from some sort of disease or infection, so then also this demand, micronutrient demand, will be high, and compared to the increase in needs and the intake is normal or low, then this micronutrient deficiency will happen. Now we will see why we will call this micronutrient deficiency as hidden hunger. So this micronutrient deficiency is compared to the iceberg disease. So it is also one of the iceberg disease. Why it is an iceberg disease means, so majority of the people suffers from mild to moderate deficiency. So it is like vast submerged portion of the iceberg, and so it is almost affecting the 2 billion people worldwide. So that is nothing but 1 in 3 people are suffering with micronutrient deficiency worldwide. So because of this mild to moderate deficiency, many people are suffering with cognitive impairment in the childhood, stunting of the growth, wasting will be there, and weakened immunity system will be there. Because of that, subsequent infections will be there. And the tip of the iceberg is like only severe deficiency will show signs and symptoms, like because of vitamin A deficiency, night blindness, then white hot spots, corneal cirrhosis, corneal ulcers, like that. And because of iodine deficiency, goiter, like that we will see in latter stages. So that is nothing but during severe deficiencies we will see. So that is compared to the tip of the iceberg. So only few cases will be in the tip of the iceberg, and majority will be in the vast submerged portion. So that's why this is also one of the iceberg disease. So now why we are calling it as hidden means clinical signs like night blindness and goiter will appear only when deficiencies become severe, as we discussed. But vast majority of the affected individuals suffer from mild to moderate deficiencies. That is nothing but invisible to the naked eye when we see one person. So that's why we are calling it as hidden hunger. And so the broader impact of this hidden hunger is not only health effects, but because of this health effects, illness, growth retardation, cognitive impairment, this is also hampering socio-economic development of the nation. So, what is triple burden of malnutrition? So, triple burden means three diseases you can think. So, one is undernourishment, one is micronutrient deficiency, and the third one is obesity. Undernourishment means, as you all know, insufficient calorie intake leading to wasting and stunting. And micronutrient deficiency is nothing but lack of essential vitamins and minerals, as hidden hunger itself. And obesity is so growing weight, overweight, and obesity, which is leading to chronic diseases. And why this triple burden of malnutrition is happening means globally shift is happening from traditional foods. So traditional foods means minimally processed foods to highly processed and energy dense, so rich in calories, empty calories, and micronutrient poor foods and drinks. And this is all driving to three burdens like undernutrition, micronutrient deficiency, and obesity. And this triple burden is especially faced by the developing nations, low and middle income countries, where this shift is happening more. And even in high income countries, they are facing the burden of obesity because of foods rich in carbohydrates, empty calories, like that. Because of that, obesity is growing, yet they are suffering with micronutrient deficiency.